These efforts to screen asymptomatic carriers in their admission to the hospital are an extension of what has been done already with methicillin-resistant Staph aureus, or MRSA. And it's a fantastic idea, and I'm pleased to see that they were able to show a decrease in the expected rate of C. diff cases. And they estimated, based on their study outcomes, that they prevented 63 of 101 healthcare-associated C. difficile cases, which is it's fantastic and commendable. And to achieve this, the number estimates that they have to screen about 120 people on admission to the hospital and isolate 6 asymptomatic carriers to prevent those cases of C. difficile. This seems to be a very rational approach, and I like it. I expect that based on what it costs to screen people, including the microbiology laboratory time and doing the actual cultures, versus having a case of C. difficile in the hospital, I expect that it's very cost effective. Patients may not like it, and they don't always like being on contact precautions for MRSA either. But in a public health setting, this seems to make sense, and it seems to be where we have to go at this point, given the burden of drug-resistant organisms. And it seems also to make good sense to isolate preemptively rather than wait until after we know that someone is sick. Or to isolate preemptively so that someone who's a carrier doesn't lead to healthcare workers spreading spores to other patients and making them sick as well. I think some of the barriers to implementing active surveillance and putting asymptomatic carriers in isolation pertain to cost, and also pertain to the effort that's required on the part of the nursing staff, because they're the ones that'll have to do this. And there may be also some reluctance on the part of the patients too, because this is different from getting your nose swabbed. This is a different part of the body that has to get swabbed, and that's not always something that we're very comfortable with. I don't think I would be upon admission to the hospital. A second potential barrier may be that this is one study, and I think that it is worthwhile pursuing. There may be a call for more evidence before we can start making this a widespread investment into healthcare, infection control, and prevention.